Hello and welcome to this short webinar on California's Medicaid occupational therapy coverage. My name is Zachary Edgar and my company is called Therapy Comply. Therapy Comply is a membership-based compliance firm dedicated to assisting physical, occupational, and speech therapy practices and facilities. Members can access a wide selection of guides, sample policies, and forms on Medicare, Medicaid, HIPAA, TRICARE, and state rules and regulations that apply to therapy practices. Members can also email me at any time with any compliance or billing questions or schedule a phone call. Please visit the website at therapycomply.com for more information. This presentation is for informational purposes only. None of the material is intended as legal advice. Statutes and regulations are all subject to change. This presentation describes the California Medicaid fee-for-service coverage of occupational therapy. Medicaid managed care companies must offer the same amount of care as the state but can change prior authorization, personnel, and documentation guidelines. MCOs do follow state rules in many cases, but therapists should always double-check with payer policies. On the website, we have a lot more detailed information on outpatient therapy services, fee schedules and code lists, billing for non-covered services, information on qualified Medicare beneficiaries, MCO plans, coverage, and prior authorization, and members can always request information or ask questions about any Medicaid coverage and compliance issue. Occupational therapy means services prescribed by a physician, dentist, or podiatrist to restore or improve a person's ability to undertake activities of daily living when those skills are impaired by developmental or psychosocial disabilities, physical illness, or advanced age. An occupational therapist shall be a graduate of a curriculum in occupational therapy approved by the Council on Education of the American Medical Association in collaboration with the American Occupational Therapy Association and shall be registered by the American Occupational Therapy Association. The guides and regulations do not address assistants, aides, or students. The written prescription of a physician, dentist, or podiatrist is required for occupational therapy services. The following must be present on the prescription form: the signature of the prescribing practitioner, the name, address, and telephone number of the prescribing practitioner, the date of the prescription, medical condition necessitating the services, supplemental summary of the medical condition or functional limitations must be attached to the prescription, specific services, for example, evaluation, treatments, or modalities prescribed, frequency of services, duration of medical necessity for services, specific date and length of treatment should be identified if possible. Duration of therapy should be set by the prescriber. However, prescriptions are limited to 6 months. Anticipated medical outcome as a result of therapy, date of progress review, age, functional limitations, mental status and ability to comprehend, related medical conditions, delay in achievement of development milestones in a child, or impairment of normal achievement in an adult. Prescriptions must be realistically related to activities of daily living, such as nutrition, elimination, dressing, and locomotion, in light of the patient's functional limitations. The specific goals of training or devices prescribed must be indicated. Occupational therapy services are limited to 2 services in any 1 calendar month. Initial and 6-month evaluations billed under HCPCS code X4108 do not require prior authorization, but do require the recipient be eligible for Medi-Cal the month the service is performed, on the written order of the attending physician in a certified rehabilitation center, nursing facility, level A or B, or subacute pediatric facility. Occupational therapy, case consultation, and report services billed with code X4120 requires prior authorization. Treatment authorization requests for occupational therapy for Medi-Cal only recipients must be submitted to the TAR processing center. Occupational therapy services rendered in a nursing facility A or nursing facility B recipients require prior authorization. A TAR must be submitted for services that are not included in the Medi-Cal inclusive per diem rate for a nursing facility. Authorization approval is limited to services that are necessary to prevent or substantially reduce an anticipated hospital stay, continue a plan of treatment initiated in the hospital, or recognized as a logical component of post-hospital care. For occupational therapy services in a certified rehabilitation center, NFA or NFB, Medi-service reservation limitation of 2 services per month does not apply. Initial and 6-month evaluations do not require prior authorization. Authorization is required for any additional occupational therapy service beyond the initial and 6-month evaluations. Thank you for watching, and please visit the website at therapycomply.com for a lot more comprehensive information on physical, occupational, and speech therapy compliance and billing. Please like and subscribe. We will be adding more videos very soon.